Hi, everyone. We're coming to you tonight to talk to you about health insurance from an individual standpoint. We're not really going to cover the commercial side of health insurance. We will cover Medicare tonight. So let's get started. With Medicare, you got Part A, which is your hospitalization. Deductible revolves every 90 days. If you go over 90 days being in the hospital, you pay 100% of the cost. Um, you do have lifetime reserve days for one time period that will cover you up to 120 days. Um, Then you got your premium is usually zero with Medicare Part A. Then you get Medicare Part B. This has a premium on it. It also has a deductible of $183 a year. As for basically your doctors, your specialists, stuff that you're going to have delivered every day for your medical care, things like that. Both Medicare Part A and B give allowances for blood. Um, then you get your Medicare supplement. This is provided by private insurance companies, picks up the cost after Part A and Part B is paid and pays the difference. Can be very expensive, goes up every year on the premium. Also, it has a very high premium to start with, starting out at $99. You also have to buy your prescription drug coverage separate. Usually doesn't come with added benefits like a gym membership, dental, vision, hearing. So you got, if you want those coverages, you got to buy them separate. Um, Next is the Medicare Advantage, or otherwise known as Part C. Also could be a Medicare Select plan. These cover you if basically pays instead of Part A and B, but you must have Part A and B for a Medicare Advantage or a Medicare Select or a Medicare Supplement. Um, you must have Medicare Part A and or B to have Part D. We'll cover Part D in a second. With Medicare Advantage, your Part D coverage is usually included. You'll have one deductible for your Part A and B. You'll have another deductible for your Part D. After your deductible is met, you'll have small little co-insurances and co-pays. Part D, broken up into several parts. You got your deductible, then you got your initial coverage after your deductible, then you got your donut hole, and then after the donut hole, you have your catastrophic coverage. You pay a different amount in each of these coverage areas. You move to the different coverage areas by how much you've spent on your drug coverage. Some plans give over the counter benefits. Some Medicare Advantage plans have have a gym membership, dental, vision, hearing, and other added value services in them. Um, Medicare Advantage starts out at $0 monthly premium and can go up to $99 monthly premium. depending on the plan you pick and what's right for you. A prescription drug coverage will have a premium also. So these are things to remember and look at. You can also bundle supplements like a cancer, critical illness, hospital indemnity, dental, vision, hearing plans in with this. The next thing I want to bring up is the individual under 65 health, which can also be sold to a family. Medicare has to be sold on the individual basis, although I can meet with a husband and wife together. But I have to write it as an individual basis. With individual under 65 health, you got your ACA plan, which can also be called Affordable Care Act plan, Obamacare, the exchange, healthcare.gov plan. You may know it as any of these. It is where it covers everything from day one. Can't exclude any kind of condition or anything. Can be rated up because of nicotine use. Starts out at around $750 monthly premium and goes up, but with subsidy and cost sharing, you can get a plan as little as $0 monthly premium or as little as a $75 monthly premium. And it can be anywhere in between or even more than that. But it depends on your family size and what kind of subsidy and cost sharing you get. And the subsidies and cost sharing is based on your household size, whether covered on the plan or not, and based on your income, gross monthly income. Actually, I should take that back, gross yearly income. From all sources, even from like child support and stuff like that. Let's see here. Then you have the ACA alternatives. These have a pre-existing condition clause of 12 to 24 months. So certain pre-existing conditions they're going to exclude for that period of time. Others they're going to just rate up for. Higher premiums for nicotine users. Used to be you had to be a faith-based person to have one of these plans, but that clause has been changed. So look into that. Then you have your short-term and short-duration medical health plans. These are considered temporary health plans. Short-term's anywhere from 30 days to 364 days before you have to renew. Cannot have a pre-existing condition, otherwise it won't be covered. Very affordable on the ACA alternatives. Very affordable on the short-term and short-duration medical health plans as far as monthly premiums. Can be rated up because of nicotine use. Can provide prescription drug coverage. The short-duration medical health plans have a pre-existing condition clause of 12 months. They cover anywhere from 1 year to 3 years, depending on the state you're in. If you have like a 3-year plan, if you renew it in the third year or at the beginning of the third year, then basically your pre-existing condition clause for your renewal will be taken care of by your first plan, or your current plan. This allows you to keep coverage on your pre-existing conditions. So just wanted to explain that to you. Of course, you can also have accident, cancer, critical illness, short-term disability, long-term care, dental, vision, even a hearing plan we do have that we couple with a dental and vision plan. Also, we want to show you our telemedicine plan because that can be a very good way to save on your healthcare costs.
Our Real Money team is back, saving you a lot of money on your doctor bill. Americans, on average, spend up to $200 for each doctor visit. So imagine being able to visit your doctor without leaving home and cutting the cost in half. ABC's Paula Ferris with a way to keep that money in your pocket.
With 3 growing boys, the Allspaws from Dayton, Ohio say their home away from home is often the doctor's office.
We really do have a stack of medical bills, and it overwhelms me.
For the boys, $90 each visit, $100 for mom and dad, and the costs are adding up.
Just wondering, is there a better way?
According to our healthcare consumer advocate, Michelle Katz, there is. It's a brand new high-tech medical service. Hi. But for most families, Michelle says they don't even know it's an option or figure in the extra costs.
It costs money to take off from work, to get all the boys in the car, drive down, to wait a few hours to get a diagnosis that you might already know about.
It's used to treat minor ailments like cold symptoms, which alone account for nearly a quarter of family doctor's office visits.
It's starting here.
Phil's trying it out for what he thinks is poison ivy.
What would be $100 just to tell me that I got the poison ivy that I know I have?
Taking a picture.
I have the picture.
Uploading it and answering a few questions.
Hello?
An hour later, Phil gets a call from a doctor, a prescription, and fills it at his pharmacy.
We've got a very affordable alternative to an emergency room for non-emergent care.
Dr. Howard says telemedicine is to help families stay healthy in between regular doctor's office visits. In all, Phil's bill was about half of what it usually costs him to visit the doctor's office. And Michelle estimates the Allspaws can save more than $2,600 just this year.
I'm amazed. I am simply amazed.
That's real money!
Sometimes it takes a little while for a new idea. When it does, watch out. Just look at Teladoc, TDOC, the world's largest virtual healthcare provider. We've been following this story for over a decade, ever since Teladoc was still a tiny startup. I've always thought it had an amazing concept. Let people have video conferences with their doctors. You shouldn't always have to go to the doctor's office to get medical care. Hey, sometimes you get sick when you go to that office too, let's face it. Not long ago, came public, 2015. The stock quickly went into free fall, plunging from 30s to the single digits in a matter of months. Since then, though, it's been a rocket ship, a deserved one. Last year, Teladoc more than doubled. It's up more than 60% just from 2018. Now we're in a situation where the results are speaking for themselves. Plus, just last week, the company announced that it's buying a competitor, Advanced Medical, and its stock shot to new highs. Let's check in with Jason Gorevic. He's the CEO of Teladoc, to learn more about this deal and his company's prospects. Mr. Gorevic, welcome back to Mad Money. Good to see you, sir. How are you?
Good to see you.
All right, I got to tell you something. You should be very pleased by what I'm about to tell you. I posted in this morning on my Twitter file that what are people's experiences with Teladoc. I have, most people are very critical on Twitter. There was not a single negative experience. It was just positive experience after positive experience after positive. What are you doing?
Yeah, it's funny you say that. I used to run health plans. I got a lot of hate mail when I ran health plans.
I figured I'd get a lot of hate mail when I put your name up.
Now I get fan mail. Maybe not as much as
tell me about that. I love this contrast.
No, it's great. It's we're delivering care to people where they need it, when they need it, on their terms, right? And that's how the healthcare system should work. And it's nice. Consumers are understanding it. Payers are understanding it. Employers are understanding it. And we've been fortunate to be the beneficiary of that.
One of the tweets was someone got sick in the car, pulled over, called, got a diagnosis. Can it be that simple?
Oh, it really can. Yeah. I mean, technology being what it is, we can now match a doctor with a patient in their jurisdiction where they're licensed, matched up with their specialty, and take care of them in a matter of minutes. And, look, people get sick not on regular schedules.
Right. Now, it is 24/7. Also, this new acquisition, to me, makes you the worldwide leader.
That's exactly right.
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But what if getting an appointment takes too long? Or even worse, what if traveling makes it impossible? You could head to an urgent care clinic, but do you want to spend $150 to wait in a room that might be full of sick people? And then there's the emergency room, but that would cost $750. And the waiting room might be full of really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board-certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctor will listen carefully. And when enough details are given, we'll diagnose what you have. The prescription is sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience of Teladoc doctors, 15 years. At the time it takes to get a call back from a Teladoc doctor for quality care you need, 22 minutes. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once. You'll love it.
What is that?
A bottle.
A bottle. What's in the bottle?
Nothing.
Nothing's in the bottle. All right.
Me? Mom, come on.
I'm still working. I just need more help from you.
I'm doing the best I can.
I feel like everyone is leaning on me to do everything, Mom.
You know, it wasn't always easy with you and your dad either. But you're losing out on moments you aren't going to get back. Maybe it's time you talk with someone.
Hi. Thanks for seeing me.
I'm glad you scheduled some time. How can I help? Make some mental notes, and we can talk about it next time.
Thanks, Dr. Brown. Let's meet next week. This castle needs a dragon, huh?
They're finally asleep. How are you?
I'm good. I think we're gonna be all right.
Do you not have insurance for prescriptions, not enough coverage, or no coverage at all? Are you not getting the medicine you need for care because of the cost? Despite for almost a decade, chain pharmacies nationwide have been selling select generic drugs for as little as $1 per week, medicine cost is still a burden to households across the United States. Our program will lend you a hand. Now that you have access to the doctor with our teledoctor service, let's get the prescription worked out. If your insurance plan does not cover the cost of all your medications, or if you do not have insurance and you choose the cost-effective generic drug route, either way, our plan will drive down the out-of-pocket expense. Get discounts at over 58,000 national chains, regional chains, and independent pharmacies. Get 20% to 60% off retail prices for generic drugs and 20 to 40% of name brand drugs with no limits on quantities. Use mail order pharmacy as well and purchase up to a 90-day supply of your maintenance prescriptions. Our membership card is the gold standard for prescription savings. Enroll today. I know what the next question is about: vision. Don't worry, we have the answer. Your healthcare savings plan also includes 15% to 35% off normal retail prices for frames, lenses, and specialty items, such as resistant coatings and ultraviolet protection. Contact lenses and even LASIK and PRK procedures also receive discounts, up to 15% off retail prices as a matter of fact. This keeps money in your pocket should you need glasses, contacts, or ophthalmology services at any time. Just present your membership card and save all around. Enroll today.
If you don't have a roadside assistance plan for your car, you may want to get one soon. One of the most common things we never think about until it happens: transportation issues. The winter and fall months are when most drivers need help with such issues as dead batteries, flat tires, and keys locked inside their car. Spring and summer are filled with road trips and more time behind the wheel. You could miss work, family activities, important dates. Never be stranded again. In our package, you have access to emergency road service 24 hours a day, anywhere in the US and Canada. We deliver gasoline, change tires, provide jump starts, unlock the vehicle, winching and extraction services, and delivery and installation of parts. We'll also tow your covered vehicle to a location of your choice. We do it all to keep you on the road. Enroll today.
It seems like AIA covers everything and truly simplifies your life. But something is missing. What about man's best friend? Well, we have that covered too. Pets are unpredictable. While it's hard to anticipate accidents and illnesses, our affiliations with Nationwide helps make it a little easier to be prepared for them. From preventative care visits to significant medical incidents, Nationwide provides protection for pets when they need it most. Nationwide policies cover a multitude of medical problems and conditions related to accidents and illnesses, including cancer. Coverage is available for dogs, cats, birds, and exotic pets. Plus, optional wellness care coverage reimburses for vaccinations, flea tick preventative, and more. Members are free to use any veterinarian worldwide, even specialists and emergency care providers. Best of all, members are eligible for preferred pricing, which makes this peace of mind protection even more affordable. You're free to use any vet, anywhere, receive preferred pricing as an AIA member. Also, our 24/7 vet helpline is available as a service to all pet insurance members, a $150 value. Tell a doctor for pets. That's right. All pets deserve to live life to the fullest. That's why we're there for the big stuff, the small stuff, and all the stuff in between. Enroll today. The AIA membership is the gift that just keeps giving. You earn AIA rewards just for being a member. Use your rewards to save on travel, gift cards, merchandise, and more. The savings are available to the primary member plus their dependents. Save up to 40% on 13,000 hotels and condos worldwide. Enjoy 10% discounts on popular dining and retail gift cards. Get up to 80% savings on the daily deal. Save an average of 46% on software. Find deals on jewelry, apparel, electronics, cruises, and more. As a new AIA member, you receive $250 in AIA rewards in your own online account. Plus, an additional $50 in rewards will be deposited each month you remain an active member. To start using your AIA rewards, simply log in and start saving. Enroll today.
Now, all this that you've seen so far is included for a low monthly fee and a one-time enrollment fee. The roadside assistance covers 2 uses per year. So that's very important to remember. We do have another roadside assistance plan that it's very affordable that we can sell you that will cover any other uses that you may need. Covers really just like the AIA one here. Just it covers anytime you need it. And it's $19.99, and you pay for the first 2 months up front, and then you pay your monthly fee after that. So basically you're paying for your first and your last month, and then you're paying all your other months up as you go through. We're fixing to look at 2 add-ons to the AIA. These can be added on for a little bit extra each month.
Association RX. What if you knew the cost of your medicine before you went to pick them up? And what if those drugs were tiered and capped for your benefit? Look no further. Select our pharmacy add-on to your Simplify package. Our relationship with Association RX has a network that includes over 60,000 pharmacies throughout the U.S. The network includes national chains as well as thousands of independent pharmacies. Up to 65% savings on generic medications, with overall average savings of 40% across brand and generic medications combined. This program is designed to help you find drugs within the same therapeutic class as a drug you may be currently taking. Most of all, this program is designed to save you money on your prescription drug costs. This program offers 4 tiers of saving. Tier 1. The first tier is generic drugs that will be available to you for a payment of up to $10. Tier 2. The second tier is brand name drugs and select drugs that will be available to you for a payment of up to $20. Tier 3. The third tier is brand name drugs and select drugs that will be available to you for a payment of up to $50. Tier 4. The fourth tier is brand name drugs that we have negotiated special network pricing for you. For special network pricing, present your card at a participating pharmacy. You can visit www.associationrxcard.com for more details. Log on and check the price of the drug you are looking for and see participating pharmacies. To get the most out of this program, you should ask your doctor to prescribe a drug within the first 3 tiers if possible. Secure your pharmacy needs with AIA. Enroll today. Dental. Everyone wants that perfect smile and that amazing treatment plan. Add on dental to our Simplify plan today. Now, our members can save 5% to 60% on virtually all dental procedures. Since the dental program is administered by Carrington International Corporation, you now have access to one of the largest dental networks nationwide. Members will pay the discounted rate at the time of service. Receive unlimited access to care with no limits on the number of visits. The procedures range from cleanings and fillings to root canals and crowns. Savings on orthodontics are available for both children and adults. All dentists must meet highly selective credentialing standards. Visit any participating dentist on the plan and change providers at any time. You can smile again. Secure your dental options with AIA. Enroll today.
So showing you the base. The base is $49 a month, one-time enrollment fee of $49. Very easy to join and stuff. You can go to our site, which we'll have included in the post. You can also give us a call at 662-912-3914. Again, that number is 662-912-3914, and we'll be glad to help you with this. Any of this that you've heard today. We can also help you with your other insurance needs. We appreciate you taking the time to watch this. We look forward to helping you. And the AIA is available across the U.S. So whereas the healthcare and our other insurance stuff and all is available in Mississippi, Tennessee, Arkansas, Louisiana, Alabama, and Michigan. Thank you. Have a nice day and look forward to talking to you soon.